Hey, Ed Paget here, and today I want to talk to you about these things, foam rollers. The word foam roller seems to give the impression that you're going to be rolling back and forth on it, but actually I've found that isn't the best way of doing it. But I'll show you what I mean. So most people would take one of these foam rollers and they would say, I've got to work on a certain muscle and I'll put it here and I'll go up and down like this, right? Well, it turns out that what that does is actually just cause a lot of pain and doesn't change the muscle in the way that we're trying to change it, which would be to increase mobility. So I'm going to propose a different way of doing it. If you actually work a little bit slower, you can push the blood through the muscle into different areas and flush out what we call waste products, which cause the pain, things like lactic acid. And then those waste products come out of the muscle and the muscle can start to relax, new blood rushes in, and you can actually start to change the tone or the tension in muscles that way. All right, I've got 3 foam rollers here. This is the original gangster, the old one. Now this has a little bit of give to it and is softer, and this is less painful. Then we go to a travel roller. Essentially, this is a bit of plastic with a covering on it. The covering is like a yoga mat. Inside this comes with a bunch of balls, which we'll talk about as well shortly. Thirdly, for those of you on a budget or without access to these things, I've literally got a piece of piping. In fact, I found this just on a run on a building site or near a building site, and this is perfect. So when I started foam rolling, this thing was painful, and the athletes that I used to work with would use these, and I couldn't understand how they could do this without being in serious pain. It turns out over time your sensitivity to the pressure rapidly decreases, and you could end up actually using something like this, which is what I do use occasionally. All right, so what I'm going to do is going to pick a few muscles, and I'm going to show you how I would recommend my clients foam roll them. The classic muscles to work with are going to be the quads, the lateral quads, and the calves. And also I'm going to show you how to get in here onto the adductors. So let's go for the lateral side here. What we have here is the thing called the IT band, right? This is the thing that gets tight when you run a lot anyway. Now, working directly on the IT band is just going to cause a lot of discomfort, and it's probably not going to change the IT band tone massively. However, working slightly to the front of it, slightly behind it, and up onto its attachments up here into the glutes and the tension fascia lata will actually make a difference. So what we're going to do is we're going to take the foam roller, place it at 90 degrees to the IT band, and now I'm directly on the side of it, and that's painful, but I'm going to roll slightly forward so I come off the IT band slightly. Now, you do move up and down until you find a point where things get really tight. So, for example, I started here, I'm going to move this way a little bit, now I'm onto a tight area. Once I'm on the tight area, I'm not going to go up and down anymore, I'm actually going to go forwards and backwards. So I'm rotating, I'm pushing the muscles around the bone in my thigh, my femur. And these muscles actually attach to the femur, and this is stretching them right down to that attachment. Now when I feel like a change in my muscle, I will then simply move up a little bit further until I get to the next tight area, and again rocking backwards and forwards. You do this nice and slowly, and in your mind's eye I want you to think about fluid being pushed through the muscle, and as you roll back off it, fluid rushing back into the muscle. So it's actually a fluid pump that we're thinking about here rather than stretching the fibers. Okay, so you would do the whole side in a similar manner. Now when you get up above your hip bone here, this thing here is called the greater trochanter. It's the bit that sticks out. You're going to go above that into the pocket area, obviously on my downside. And now that is the TFL, the tension fascia lata, which is the muscle that tenses the IT band. Now, I actually don't feel anything with this thing now. Now, this is too soft for me. So this is where I would just simply grab one that's a little bit harder and work into there. So now I can start to feel it. So again, we're not going up and down. I'm simply just rocking backwards and forwards. Now you can actually use this bottom leg as well actively. So I can move this forwards and backwards if I wanted to. So I'm pinning the fibers of the tensor fasciae lata, but now I'm stretching them in a running motion. And this is actually fantastic for people who struggle with IT band syndrome, which is something that I have struggled with in the past. Okay, so working up either side of the IT band, working into the tensor fasciae lata. The next place to go is the glute muscles. So this one again will be too soft for me in this situation, might be fine for you. You're going to essentially sit on the foam roller, then cross in my case, the left leg, or it's the leg you want to work on. And then you're looking for an area of tightness. And once you find that, you're just simply going to rock backwards and forwards. Again, it's tempting to do this because it feels nice in this situation, but it's not as effective as slowly working the fibers of the glute max and then some of the deeper fibers here as well. And so most of these muscles actually come from the sort of sacrum area and spread out like fingers, the deeper muscles like this. So I could actually turn the foam roller through 90 degrees and now have it so it's crossing the muscle. So it's going to be like, imagine this is the muscle here. It's like crossing the muscle here as opposed to being this way. Now from here, I can move my pelvis forwards and backwards and just get a different motion here. Or I can do very gentle rocking left and right. So you're going to play with it. You know, the muscles in different fiber directions, some of them will respond better to this, some will respond better to having the foam roller pointing the same direction as the muscle fibers. Okay, so that is a good introduction to lateral leg and to the butt. But how do we get these pesky muscles on the inside? So there's a few ways of doing it, depending on your flexibility levels. So I'm going to use the bigger roller here, because these muscles can be very tender. The first thing we're going to do is take the leg and put it up onto the foam roller. Again, you roll until you find a sticky spot or a painful spot, and then from here you simply lift your leg up and down. So that's how you get that sort of circular motion around the actual bone onto the foam roller. And then you will go a little bit closer to your pelvis, and you keep going, 10, 15 of these, or until you find a change. Now, some of you won't have the flexibility to do that, and so you can just use a little stool or a chair. You put the foam roller up on the chair, and then you can actually get your leg onto the foam roller. Now, this also helps the foam roller get right up into your groin, and so you can actually get the whole length of those adductor muscles. So from here, I'm right up on the attachment where it goes close to my pelvis, and I'm getting a nice stretch and release through that muscle by using my leg. And you can see I've actually just do 3 or 4, then I move just a little bit, get to the next tight area, and I would simply work my way down through there. So once I've released off these muscles and pumped the blood through using these foam rollers, that wouldn't be it for me. Then I would move into a more dynamic stretching routine, so similar to yoga or the fast class, which I have elsewhere on my channel here, to then give the muscles and the nervous system a full range of stretch and a full range of contract to tell them exactly how they should be functioning in every joint in all 3 dimensions. So go on, give that one a go. Foam rolling plus a little bit of full body functional movement at the end. And if you like what you see here, make sure you click subscribe so you don't miss my next videos.